to you all. Ingrid, to you first. Tens of thousands of workers will be very concerned about their jobs and their income. What's the rationale behind these payments? How exactly will it work for people?
Well, the key to that is in the word temporary. The government believes that while this has been a sudden and massive shock, with literally over 100,000 workers being unemployed since last week and more to come, that they have to stem the tide of job losses. Regina Doherty herself said today that last week she had forecast 400,000. She now believes that is a conservative estimate. So what they're trying to do is stop people permanently losing their jobs. And the rationale behind this scheme, which is going to cost €3.7 billion over a period of 12 weeks, a massive investment, is to keep employees linked to their employer. And so that when the restart comes, when the rebound comes and we can all get things rolling, that employees won't have to go through applying for jobs, employers won't have to go through hiring them, and people can get back up and running quickly if that's possible at all.
Fergal Bowers is at the Department of Health. Fergal, what are the health reasons for these measures? If you could explain to people exactly how it's hoped that these will make a difference.
Well, there are good medical grounds for those significant measures announced today. We see that 45% of cases are community transmission, and in a lot of cases they don't know what the source is. So that's a difficulty. We have a day-on-day increase now in admissions to intensive care units. Over 1,000 confirmed cases, 6 deaths, and in some of those, sadly, we know that there was not an underlying health condition. And in 1 in 4 cases examined, they're healthcare workers, the frontline people on the defence of this. So they're essential services. On a positive note, testing capacity is being increased and contact tracing is also being increased. And with these new restrictions, the hope is we can stop that happening, hitting that peak curve there. If that happens, we are in a serious situation. But all of the measures announced today and the ones already in place are aimed at keeping that level down low. And the best advice people can take is the simple advice: social distancing and adhering to the hygiene measures that everyone should now be familiar with.
Yes, indeed. Paul Cunningham was at government buildings. How serious are the government about getting this message across to the public, Paul, and what's the wider reaction being to these unprecedented measures?
Well, I asked the Taoiseach at that press conference whether he would describe the measures announced today as a lockdown, and he disagreed. He said that phrase caused more confusion than clarity. What he preferred to describe it was unprecedented measures required to deal with an unprecedented health emergency. And if you just zone in on one of those issues, that order that when it comes to social gatherings, no more than 4 people should gather unless it's a family, in which case the number can be higher. It certainly is unprecedented. Gardaí are now going to have a far more high-profile role in going along and advising people to abide by these standards which have been recommended by the Chief Medical Officer. And in the case of non-compliance, they're able to order people to desist, and if not, they have powers of detention. So there is iron in that velvet glove. The Taoiseach said he hopes people will comply given the nature of what Covid-19 presents, the nature of the problem. But if people don't, the Gardaí will act, and if more legislation is required, the government will introduce it.
And Fergal Bowers once again at the Department of Health. How significant do you see this move where private hospitals will essentially operate as public hospitals? And also, I know we'll be getting an update on the figures later on tonight, of course, but in the meantime, this is a big move in terms of healthcare here, isn't it?
It's a major decision, and by agreement the state is taking over private hospitals in this country for the duration of this emergency. That's going to add 2,000 beds, 9 laboratories, critical care capacity and valuable extra staff. So that's important. There's going to be equality of treatment for patients. So it doesn't matter whether you have private health insurance or not. Everyone's going to be treated the same. Although I'm told essential care that has been lined up will continue to go on in private hospitals, but that would be important if you had a procedure lined up for next week, for example, as part of your private health insurance. But private hospitals will, for all intents and purposes, be public hospitals, and that has never been seen before in this country.
Yes, indeed. And Ingrid, as you examined these measures for workers today, did you uncover any glitches that may turn themselves up as this system goes into operation?
Well, there are two things that strike me, Ray. One, for the first time we have differentiated social welfare payments. For example, if you're sick with a broken leg, you will get €203 illness benefit. If you're sick with the COVID illness or have to self-isolate, you'll get €350. The same differential applies between someone who was laid off up to recently and somebody who is now part of the laid off as a consequence of COVID-19. They'll get 350 as opposed to the standard benefit of 203. Father John Healy of Social Justice Ireland has already criticised that. And secondly, there is no obligation on employers to top up what the state is putting in. The Department of Social Protection says it's strongly encouraging employers to do so, but there is no obligation. And secondly, we don't know if some employers who are already paying their staff in full will resile from that in order to avail of this scheme. So we've a long way to go, but again, the object of this is to get money into people's pockets and to keep people on the books to make things easier to restart the economy when this crisis passes.
Yes, indeed. Ingrid Miley, Fergal Bowers, Paul Cunningham, thank you all.